Hello, everybody, and thank you for joining. We're just going to give folks a couple of minutes to join, and then we'll get started. Great. So thank you again, everybody, for joining us and our guest panel for today's webinar on emergency preparedness for seniors. For those of you who aren't familiar, WACARES is the state's new long-term care insurance program for workers. Our WACARES Conversations webinar series is designed to give you a high-level overview of a topic related to long-term care. I am your host, Sam Klewicki. I'm the Communications and Marketing Manager at WACARES. I'd like to go around our panel and have each person briefly introduce themselves, starting with Holly.
Hi, I'm Holly Stark. I am the Disaster Preparedness Outreach Program Manager at Washington Emergency Management Division.
And Serena.
Hello, I am Serena Segura. I am the Emergency Management and Risk Officer for the Aging and Long-Term Support Administration at the Department of Social and Health Services.
And Richard.
Hi, my name's Richard Freed. I'm the Emergency Preparedness Coordinator for the Residential Care Services under DSHS. We're the branch that oversees all long-term care facilities.
And Sebastian.
Hi, everyone. I'm Sebastian, the Outreach and Language Access Lead for the WACARES Fund.
So we're going to start with some remarks from our panel members, and then we'll share an overview about WACARES and how it works. Then we'll have an opportunity for an audience Q&A. You're welcome to go ahead and enter your questions using the Q&A button as they come up for our panel to answer later in the webinar. The slides and a recording of this webinar will be posted on our website later today at wacaresfund.law.gov/webinars, and you can see it at the bottom of the slide here. I'm going to go ahead and pass it along to Sebastian to get us started.
Thank you, Sam, and thanks everyone again for joining us. We're going to just start by defining long-term care and caregiving. Of course, I'm sure these are terms that we've heard before, and some of us may have some experience, direct or indirect, but just so that we're all on the same page about what they mean generally. So starting with long-term care, we can define that as help with activities of daily living that can include bathing, eating, dressing, preparing meals, grocery shopping, and many other activities as well. It does not include, however, medical care, right? So those are things like doctor's visits and treatment for medical conditions. Long-term care covers a broad spectrum of different needs and circumstances, including for younger people who may have unexpectedly been injured or become disabled or ill. And we also might not realize what a broad range of services can be included when we talk about long-term care. So we might often think of it as care in a more residential setting, like a nursing home or assisted living, but it can also include care provided in our own homes. And really most people with some sort of long-term care need can stay in their own homes with the right types of supports. It's also very common for family caregivers to not realize that they are, in fact, a caregiver. So a caregiver is someone who tends to the needs or concerns of a person with short or long-term limitations due to illness, injury, or disability. So for example, you might go to your mom's house a couple times a week and cook meals, drive her to some appointments, and make sure she's taking her medications, which are all common care activities. And again, the majority of this type of care is provided on an informal basis, meaning that it's unpaid care from a family member, could also be a friend, a neighbor, a loved one. So now that we do have a general understanding of long-term care and caregiving, and we'll talk more about this throughout, we're going to pass it on over to our panelists to learn more about the programs that they work for and the importance of emergency preparedness for seniors. So I'm going to pass it over to Holly first.
Thanks, Sebastian. So again, yeah, I'm Holly and I'm with the State Emergency Management Division, and I work in the Hazards and Outreach program, which specifically focuses on our kind of big major geologic hazards, volcanoes, earthquakes, and tsunamis. And then I have a component of preparedness that touches all the hazards where, you want to be prepared for them. And so today I just really hope to bring something that's actionable, that's simple, and that's really empowering to you to be able to go out and start being more prepared and going on this preparedness journey together. Go to the next slide, please. So are you 2 weeks ready? So we have found through various exercises and studies that if the big one does occur, when the big one does occur, we need most of our population to be at least 2 weeks ready to survive on your own. And it's not because we don't think help wants to come, it's just that it's going to take a while for some of our major infrastructure systems to come back online. And so we should all be prepared and resilient. And so I'm going to tell you a few actionable steps to help us move toward being 2 weeks ready. All right, next slide. So step number 1 is to know what your hazards are and how to reduce your risk from those hazards. And then step number 2 is to make plans for those hazards. And then step number 3 is gather supplies. And we're going to go into detail about each of those so we can move on to the next. Awesome. So the first one is know your hazards. And I like to say, know your hazards where you live, where you work, and where you play, or because you might be doing any of those things. So a lot of people, from like Spokane will say, well, I don't really need to know about tsunamis. And I'm like, well, do you ever visit the coast or the beach? And it just a general understanding of what the hazards are and where they can impact you. So in Washington, if you can see that map, it might be kind of small. We have a bunch of different hazards that can impact us, but they're very different from other places. So if you've ever lived in another state, like Florida has a lot of hurricanes. I moved here from Hawaii. We have very similar ones to Washington, actually, except for they get some really, really bad rains that flood a lot. All right, move to the next slide. So Washington specific, what are some of our hazards? Well, I touched on the 3 major ones that my program works on, when that's earthquake, tsunami, and volcano. And Washington actually has the second highest risk of earthquake in the nation. And that's after California. And what that means is, like, we can look at states like Alaska that have a lot more seismicity, a lot more earthquakes than we do, but we have a lot more infrastructure and population. And that's where the risk factor comes in, what an earthquake could do to the people and the infrastructure. So we have 3 different types of fault lines, and the big one that you've probably heard of, known as our big one or the big one, is the Cascadia subduction zone. And it is capable of producing a 9.0 magnitude earthquake and subsequent tsunami. So we have to worry about tsunamis as well. All 3,000 miles of our coastline are at risk of tsunami. And some of our lakes even get tsunamis. So the last recorded tsunami in the state was in 2024 in November on Lake Roosevelt. And then we have 5 active volcanoes. They're Mount Baker, Glacier Peak, Adams, Rainier, and Mount St. Helens. And they're considered active by geologic standards, but we have seen some, like Mount St. Helens, erupt in our lifetimes. So, and then, like I said, I touch on some of the other hazards for preparedness purposes. And so some of the other ones that are even more common that we see, pretty much every season are wildfire hazards and the cascading impacts of, bad air quality and ash in the air, floods. So all 39 counties in Washington state have had to declare some level of disaster because of floods. We're seeing more and more extreme heat and those big heat domes that come and settle on us for a couple of days. And that can be a really, really bad hazard. And then we have severe storms. And the reason I like to touch on some of these other smaller or more visible hazards is that, that could be the hazard that is the most difficult for us to prepare for, or if you think about what would be an emergency for you, if you don't have air conditioning and you're, going through a week of extreme heat, that is a big emergency. If you have a 4-hour power outage, that can be a big emergency if you don't know where your source of food or power or light is going to come from when you're taking steps to prepare. And so we talk about the big hazards and how to prepare for those, but also we want to talk about what happens if you're stuck on the freeway for 3 hours, and are you prepared for that kind of emergency? And it really brings some perspective to our preparedness journey. Just for your picture, that is Nisqually, the last time that we had a major earthquake that anybody felt in 2001. That's in Seattle. This is one of our unreinforced masonry buildings where the brick just sheared off of it. We were very lucky that most people were in work and school at that time, and so it didn't hurt people, but you can see a lot of damage was caused. All right, next slide. So then, as part of knowing your hazards, we want to take steps to reduce the risk of those hazards. And the first thing I always recommend to everybody, you'll hear us push it all the time, is sign up for alerts. So if you follow that QR code or go to that web address, you'll find a page full of places where you can sign up for alerts. You can sign up for your opt-in alerts for your county, which we always highly, highly recommend. And you're also going to get information about following the Cascade Volcano Observatory, so you know what's going on with our 5 active volcanoes. And then really important information about Shake Alert powered earthquake early warning, which gives you seconds of warning before you feel the shaking of an earthquake so you can take protective actions. And that's all on that thing. So you can go there. It's free. You just opt in to some of them. The Shake Alert comes directly to your phone, kind of like a wireless emergency alert, but we just want you to be aware that that happens so you do take the right actions. Right, next slide. And then another thing you can do to reduce your risk is participating in drills. Every year on the third Thursday of October, we participate in the Great Shakeout. It's an earthquake and tsunami drill. It's a worldwide earthquake and tsunami drill. And you can sign up at shakeout.org/Washington. And then on that third Thursday of every October, this year is the 16th, I want to say. So at 10:16 a.m. on 10/16, we practice drop, cover, and hold on. And a really cool thing about going there to register is there's also a lot of information about how do you practice drop, cover, and hold on if you're not ambulatory, if you use a wheelchair or a walker? What do you do if you're in a car or in your bed? And so different ways to practice those protective actions from an earthquake, depending on how you move about the world or where you are at the time of the earthquake. All right, next slide. All right, so now step 2 of our preparedness journey is to make plans. I like to say we make plans for 3 different things, and that is communication, which is the number 1. How are you going to get notified? How are you going to notify others and communicate with the outside world? And then evacuation, if that's a necessary step of your emergency. Where are you going to go? What route are you going to take? Is the pathway through your facility or your home cleared and easy for you? Do you need to make arrangements to have a ride come take you if you have to evacuate? So if you've ever been in an area that has wildfire, you might notice they give you different alert levels. And if you have any ambulatory issues or if you need transportation, they always recommend you know those levels and know that you need to start your evacuation much earlier than the next group of people. And then the other one is reunification. Where are you going to meet? Where are you going to gather with your family, your friends, or if you're in a care facility, where is everybody going to be safe? Maybe that's a shelter, maybe it's a designated family meeting spot, but you want to have all of those things in your plans. Now, if you have children still at home or grandchildren living with you, you want to probably write those down and put them in a place where they can see, stick them on the refrigerator or on a calendar. This is our plan. This is where we're going to go. This is how we're going to talk to each other. This is the school's plan or my care facilities plan or my work's plan. And I say this because I'm a single mom and I have 3 children and they go to 3 different schools And so at any given point in the day, we're in, 4 different locations. I could be at work, they could all be at their 3 schools. One gets out earlier than the other. So those plans are really important to have in place no matter what stage of life we're in. And then the last thing I leave you with on this one is I heard this really wise woman once said, practice makes permanent. And I say that rather than practice makes perfect, because in an emergency, we all know that we're not going to be perfect. We will panic. We will be scared. We will have so many unknowns. So the more we can practice our plans, write those plans down, communicate with our family about it, the more permanent they become in our muscle memory and our mind, so we can stay calmer and react better. And next slide. And then the third step is gather supplies. So we want you to have 2 different types of supplies. The first is a go bag or a go kit. And that's what you grab and go if you have to evacuate immediately. And it should have, your basics, some water, some food, some personal hygiene, first aid, something to keep you comfortable. And then some of the things that you need personally, like if you wear glasses, maybe a pair of readers. If you rely on an inhaler, you maybe want to throw that in. And I know that it's difficult to collect a lot of medicine because of the way our insurance and the way pharmacies work. So just make sure those are in an easy accessible area that you can quickly grab, or keep a list of what you need to give to emergency personnel. These are the medicines I take. How can, so you have that on hand. And then, like I said in the beginning of when I started talking to you, we want to be 2 weeks ready. That's just in your home where you live, 2 weeks worth of supplies that you can rely on until infrastructure opens up, to allow our emergency personnel to get to the people that need it the most, the fastest, so that we can, share with our neighbors, we can be resilient together. And here's a list. One thing I always find funny, I've seen a lot of funny memes, is that a lot of people have a ton of like canned food and then fail to put in a can opener. So just really make it as personal as possible. Think about the things that you would need to survive. If that's coffee every day, get some chocolate covered coffee beans. If it's, a personal item, I have a little section of my blanket that my grandma made me because it keeps me comfortable. Cash, important documents. And then we always want to remind people, if you have pets, don't forget to prepare for them too. We've found that people are much less likely to want to evacuate their homes if they don't know what to do with their pets. So just some things to think about. All right, next. And then, like I said, if you've been hearing me say, this is a journey. You might be where the little guy in red is, X, not knowing what to do. Hopefully after today, you might find one actionable step you can take. And then you might be good, better, best, and beyond, but you're never done, because we always want to check our supplies, restock them, make sure your batteries are good. And I always tie that to a date. So when the seasons change, when the times change, when you change the batteries in your smoke alarms, check on your supplies, make sure your food is good, make sure that your batteries are good and all of those things. And then just keep doing it over and over again. Refresh those contact information and make sure that you're just thinking about it in small, actionable, easy steps all the time, rather than panicking at the end. And then I think the last slide. We like to tell you guys that you can survive if you get prepared. We noticed that as we went out and talked about some of these things that can be big and scary, people would throw their hands up and go, well, I'm just going to give up. I'm going to sit on my roof with a margarita and watch the tsunami come in, or I just can't do all of that all at once, so I'm not going to do anything. And we really want people to feel empowered that if you take a step today, you're going to be closer on that journey, and then you will be able to survive. There's some more contact information. I'm pretty sure these are all getting shared out. And my email address, if you want to go down a rabbit hole and talk more about preparedness, I'm so happy to do that, or to send out materials that you can use. And that's it for me, but thank you.
Thank you. Serena.
Thank you, Holly. All right, our next portion will be talking about the actual emergencies that we respond to. So if you could go to the next slide first. So at the forefront of what we do in emergency management roles to prepare for, mitigate from, and respond to emergencies is the population we serve in the Aging and Long-Term Support Administration. So those needing long-term support. So we know that there are a lot of scenarios, like Holly was talking about, that are possibilities, from wildfires to disease outbreaks to facility evacuations to earthquake and everything in between. And through our residential care services division, Richard will talk about next, we help guide facilities to ensure they are prepared for emergencies, and we promote personal preparedness across our state. And so what does that actually look like in practice? So if you could go to the next slide, please. In 2020, we found out what that looks like for a disease outbreak. A novel virus, now known as COVID-19 or the coronavirus, was detected in Washington in January of 2020. We were the first state with a case in the United States, and we were also the first outbreak in the United States at a long-term care facility. So along with a lot of other responders, we worked on providing assistance and stability through communicating guidance to long-term care facilities, individual providers, and providing contracted staffing resources to long-term care facilities that were impacted either due to taking on more residents, which were patients from hospitals, or having staff impacted due to the virus itself. Our infection protection program became more robust, both for our staff who were going into facilities and into homes at the time, but also helping to promote a more robust infection protection program within our facilities was also another piece of work that we did. At the time, we had over 45,000 individual providers that were part of our organization. And every month we provided these individual providers who were taking care of those in long-term care in their homes with personal protective equipment, also known as PPE. This took many, many hands to accomplish. It was everything from N95 respirators, surgical masks, gloves, gowns, thermometers, to make sure everyone who was caring for those who may be impacted by this virus were protected from that. Next slide, please. So the next incident we worked on was the Montesano Health and Rehabilitation Center fire and evacuation in September of 2022. They evacuated all of their residents and their staff, and they did that very successfully. And that's because of the emergency preparedness that they do on a day-to-day basis. This was also a multi-agency response for the emergency. The response was led by the Northwest Healthcare Response Network and included partners from state and local agencies and organizations. Department of Social and Health Services, Aging and Long-Term Support Administration, and the Developmental Disabilities Administration assisted, as well as Leading Age and the Washington Healthcare Association, who assisted in finding new locations for impacted residents, to the local fire and EMS, the state fire marshal, local emergency management, the local high school where they evacuated, Department of Health, the State Emergency Operations Center, and many other support organizations to help with the emergency. Ultimately, 77 residents were evacuated and new facilities were found for them across the I-5 corridor. Through this coordinated effort, we were able to make sure everyone was accounted for from the beginning of the incident through the end, so that we didn't have anybody missing or missing any reunifications. We plan for these types of emergencies, and putting our plans to work is the next step in emergency management. And it's great that we have the partnerships that we do to make sure that things go smoothly. Next slide, please. Since 2014, our state has dealt with wildfires on a regular seasonal basis. Wildfires can impact our air quality and create the need for evacuations. And Holly talked about that as part of our personal preparedness. There are a couple of free tools that are available to everyone. That is Watch Duty and the Washington Smoke Blog, and you can see those links on this slide, and I'll add them to the chat at the end of my presentation. Watch Duty is a tool that provides information on current wildfires, and it's not just for in our state. You can move the map around and go to other states. I have family in California, so I can keep an eye on the emergencies that are happening there and help them with notifications. And then the Washington Smoke Blog is our air quality monitors across the state. And again, this one is also beyond Washington, so you could move the map around and check out other air qualities if you were traveling or you have family or friends in another area, and help alert them when air quality is not good. Next slide, please. This is what it looks like when we do a response for a wildfire evacuation. So this is an email that went out to our leadership and the local area agency on aging regarding clients who were in the evacuation zone due to the Thorpe fire in Spokane County last summer. So on this is the email that went out. You'll see on the map there are green diamonds. Those indicate where there are individual clients, and the blue square is the impacted evacuation zone. So there's 2 clients that were impacted there. We also include in there the evacuation warning levels. So they were at a level 1 and level 2. So we knew we needed to contact these clients to make sure that they were accounted for and that they were safe and didn't need additional resources or transportation at that time. If they do, then we can make sure those resources are available to them to help get them to safety. Next slide, please. The last thing I'll touch on is our state level emergency messages. We are focusing right now on making sure that these messages get translated to American Sign Language. And this is another cooperation that we're doing with the Office of Deaf and Hard of Hearing at DSHS, along with the Emergency Management Division and the Coalition on Inclusive Emergency Planning. We know that we need to make sure that our messaging reaches the populations that we serve so that they have the knowledge and ability to plan for or react to an emergency and have access to resources that they may need. So recently we have used this messaging for extreme heat so that everyone that we serve knows that there are cooling centers available and where they are located. And the situation we are currently working through is for messaging around public safety power shutoffs, which our power companies are planning for in case of wildfires that impact fire lines during certain situations. So we want to make sure that everyone gets the messaging that they need. So every day we focus on emergency preparedness. So when we need to respond, we're ready. Everyone who works on their personal preparedness to make sure when emergencies happen that we're prepared and we can be resilient. Last slide, please. And this is the contact information for your panelists today. Thank you.
Thanks, Serena. Richard?
Hi, everyone. My name's Richard Freed. I'm the Emergency Preparedness Coordinator for Residential Care Services. So my agency is actually the one responsible for regulating long-term care facilities. We do fall under the branch of DSHS that Serena had just presented. So today we're going to talk about what facilities have to do as far as emergency preparedness. Just kind of as a right off the bat, this is talking about regulations and standards. So a lot of times there's some best practices, but and that facilities may take, but this is purely what they have to do. So I'm going to make some generalizations here. There's over 6,000 facilities within our state. This is going to be talking about the regulations though. So next slide. So, emergency preparedness requirements really are going to depend on your facility type. They exist on a continuum. So, skilled nursing and nursing homes, they're going to have very robust standards that follow close to what hospitals have to follow. As you get to more independent and community-based settings, there's going to be a little less standards in place. I also want to kind of give you a warning. This is just a cursory introduction. I have about 5 to 7 minutes to present on several facility types. I've previously presented to nursing homes just on their requirements, and that was an hour and a half presentation. So this is going to be just entry level, cursory, so bear with me. I'm also going to be covering nursing homes, assisted living, and adult family homes. Those are our primary three when you talk about long-term care. There are a handful of other types, but we're not going to be covering those just for time and brevity. So next slide, please. So nursing home is going to be your most robust setting type for emergency preparedness. We have a set of WACs, so those are Washington state rules, but most facilities are actually going to be following our federal rules, which are our CMS rules. This is 108 page of standards. So this requires some pretty robust planning for skilled nursing facilities. You have to do what's called a hazard analysis. So similar to what Holly had said of know your hazards, facilities are required to do this so that they can take preparedness based on the most relevant hazards. They do population-based planning, so they have to know what their clients and residents are doing and take steps to plan catered to that population. They are required to do 2 emergency exercises a year. They have to do continuity planning based on different types of hazards. So think what happens if this facility can no longer operate, what happens if they have staffing issues, that kind of thing. They're required to have backup systems and just a lot of other standards. Like I've said, I've had a presentation that was an hour and a half long before just on the standards that they're supposed to follow. In addition to the federal standards, they do have to cover our Washington Administrative Code. So 388971740 is a state-based set of standards. All facilities are required to follow this code, whether or not they follow CMS standards. And I believe it's all but just a handful of skilled nursing facilities within the state are on the state-only standards. Nursing homes are the only facility type required to have backup power and air conditioning. For certain facilities, they may have these just because it makes sense, but nursing homes are the only facility required to have these systems in place. Next slide, please. Next, we're going to cover assisted living facility. So they fall under what's called the Washington Administrative Code 38878A2700. This chapter is called Emergency and Disaster Preparedness Standards for Assisted Living Facility. They have an assortment of basic requirements. It includes first aid kits, flashlights, what staff are required to do, how they coordinate with first responders, certain planning elements, and emergency communication. They are not required to conduct emergency drills or exercises. They are not required to have hazard assessments. And then just kind of overarching, they require residents to be ambulatory unless there's certain requirements are met with the fire marshal's office. So the subtext here is that any sort of evacuation, there might have to be some semi-independence with that. They're required to have air conditioning, but they are not required to have backup power. We find this especially concerning during events like winter storms. We're seeing power shutoffs occur in response to wildfires. So backup power is not required. Of course, I'm making generalizations here. Every facility is kind of different. Some share campuses with nursing homes, so they may have backup power. Some may do it just as a best practice. So when we kind of tie it all in together, when you or your loved one are looking at facility, these are the kinds of questions you want to ask and kind of inquire before really choosing a facility. Next slide. So next we're going to go into adult family homes. These are probably the least robust disaster planning requirements. They are required to have food and water for a 72-hour period. So when you hear about what's best for your home and your loved ones, we know that that's probably going to be closer to 2 weeks. They're required to only have 3 days worth of supplies. They have to have disaster plans that may reasonably occur, but they are not required to have hazard assessments. They have some very specific language for fire evacuations. So if your a resident cannot be admitted if they cannot be safely evacuated. So that's going to depend on ambulatory level as well as the facility. So that's kind of up to them to make that assessment. But residents have to be able to evacuate within 5 minutes or less. They're required to have regular fire drills with residents. And there's no sprinkler system unless they're rated to have 7 or 8 residents. The default license is for 6 residents. So if they have the enhanced license to allow for 8 or 7 or 8, they are required to have sprinkler systems. But one thing we do know is that they are not required to have backup power or air conditioning. So depending on the area, this could be something that you want to scrutinize before choosing a facility. There has been certain programs in place to install like heat pumps. So there's been grants available to adult family homes. Just we know that this is a concern for the population. But right now it's not a requirement. So next slide. So just kind of closing the loop of what to do when you are choosing a facility. So taking kind of the things that like Holly and Serena had said, so familiarize yourself with the regional hazards. So if you know that you're in like eastern side of the state where it gets really hot, you may want to know that what their air conditioning requirements are. And you certainly should ask the facility about their emergency preparedness program, see what steps they have in place. And just know that many facilities may exceed their requirements as it's either practical or they just have a enhanced culture of preparedness. So we see it's pretty common for adult family homes, especially on the east side of the states, to have those heat pumps or air conditioning. They may have backup power because it makes sense. And then finally, understand what you or your family's role may be in an emergency. So maybe you live close by to the facility and you can actually house your family member if there was a disruption to power or any sort of emergency. Ask yourself, do they meet the ambulatory requirements for the facility? And just are they able to evacuate independently? So next slide, please. Here's some further reading to provide everyone. Again, I apologize that this was a very cursory, high-level introduction to preparedness, but I've linked the requirements to the facility types. So if you are curious and want to research it further. And then the top link is actually the preparedness resources on the website I maintain for providers. So these are the kinds of resources that if I get questions that I'm directing them to. And finally, if you have any questions about what a facility can and should be doing for emergency preparedness, my email is included. But I want to thank everyone. That's all I have.
Thank you, Richard. Next, we are going to move over to Sebastian, and he's going to give an overview of the Walk Cares Fund and talk about how the program works and how it will be helping working Washingtonians. Then we're going to move into the Q&A portion of the webinar. So feel free to enter any questions that you may have for any of the panelists into the Q&A. Sebastian?
Awesome. Thank you, Sam. So yeah, like Sam mentioned, we'll go ahead and jump into the Walk Cares portion of the presentation and sort of walk through how the program works and how we may be able to use the benefits. So Walk Cares is a universal long-term care program in Washington State. And it's an earned benefit, which means that you contribute for a certain number of years to qualify for benefits. And we'll get to what that looks like here in a little bit more specifically. But it's entirely self-funded from worker contributions. So those contributions go into a dedicated trust fund, which is used only for this program. So workers contribute 0.58% of every paycheck to Walk Cares. So we can see here what that looks like for a typical worker in our state who makes just about $50,000 a year. They would contribute $291 each year, or $24 a month. And you only contribute to Walk Cares while you're working. So if you retire or become unemployed, then contributions stop. And everyone is covered at the same rate, regardless of any pre-existing conditions. So when it comes time to claim your benefits, there are no copays, no deductibles, and you never need to file a claim or pay upfront for services. Instead, we connect with the contracted providers for the services you want, and we'll pay them directly. And contributions to the program began in July of 2023, and the benefits will become available in July of 2026. So we're going to look here at just some scenarios of what contributions may look like over the course of someone's career. Won't get into each one specifically. We'll focus on that middle column there in green. Again, we just mentioned, right, the typical worker in our state who earns about $50,000 a year. We said that they contribute $290 each year. But if we look over the span of what could be a career, right, about 30 years or over 30 years, that comes out to $8,700 that they would have contributed to the Walk Cares Fund. And at the bottom of the screen there, we can see that the full benefit amount is $36,500, and that amount is adjusted up to inflation each year. All right, so this is where we'll talk about contributions and how one can qualify for benefits. So everyone who is contributing to the Walk Cares Fund more than 500 hours per year is earning benefits, and that includes part-time and temporary workers. So by contributing for a certain number of years, you can earn access to that $36,500 benefit. So there are 3 pathways to meeting those contribution requirements. So we'll start on the left-hand side and sort of work our way across. So the first is the lifetime access, and this is the pathway that we expect that the majority of Washington workers will use to qualify for benefits. So for this pathway, workers must have contributed for 10 years without a break of 5 or more consecutive years. And this earns you access to that full benefit amount, which again is $36,500 adjusted for inflation. The middle column there is the early access pathway. So this is for workers who maybe have not yet earned the lifetime access, again, the total of 10 years, but have a care need while working or soon after leaving work. So to qualify for this pathway, you need to have contributed for at least 3 of the past 6 years at the time that you apply for benefits. And this pathway also earns you the full benefit amount of $36,500. And lastly, we have the pathway for near retirees, and this is one that was added to the program more recently. So if you were born before 1968 and are therefore near retirement when the program begins and unlikely to qualify for that 10-year pathway, you earn 10% of the full benefit amount for each year that you work. So just to give an example, if you work and contribute for, again, at least 500 hours per year for 3 years, you'd earn 30% of the full benefit amount, which comes out to just under $11,000. And that amount is also adjusted for inflation. So even if you only contribute for 1 year, you can still earn 10% of that benefit amount. And near retirees will have permanent access to whatever percentage of the benefit amount that they earn and at any time that they need care. They're also able to qualify through one of the other pathways if they met those requirements. All right, moving along to how we can use the benefit. So once a worker has met the contribution requirements that we just talked about and needs help with at least 3 activities of daily living, they can get access again to that benefit amount for services and supports. And with WA Cares, workers get the flexibility and also the freedom to choose the services and supports that meet their needs. So that could be in-home or residential care, but that could also include some home modifications to make our home safer, like grab bars in the bathroom, maybe assistive technology for things like medication reminders and fall detection that can help right with some of those care needs. WA Cares is designed to help people age in place and in their homes as long as possible. And that's what most of us would like to do, right, and want to do if we have these kinds of supports in place. And WACARES has many options to provide support for family caregivers. So you can also choose someone who would otherwise be caring for you on an unpaid basis to get training and be paid, even and including your spouse. So WACARES helps lessen the impact on family caregivers by paying them for their time and making sure that they can get their other support services as well. All right. So how far will the benefit go? Again, 3 scenarios here, and I'll start with the left one. So we have you could pay a family caregiver for 10 hours a week for 2 years, which costs $31,300, and additionally include care supplies for about $2,000, which comes out to a total of $33,500, right? Which is all within that full benefit amount that one could receive. So about a third of people need care for a year or less, and for those people, WA Cares may be able to cover all the care that they need. For others, WA Cares provides the family with some immediate relief and also time to plan for future care costs. We could also look at that middle column. You could choose services to help them stay safely in their home. So they could purchase, we see there $15,000 worth of renovations, like bathroom modifications or a wheelchair ramp to improve their home accessibility, get an electric wheelchair or scooter, and have meals delivered for 3 years for about $26,800. Dollars. Or the last example there, someone who needs long-term care due to maybe an unexpected injury could get 20 hours of in-home care per week for a year, plus some transportation to appointments and crutches for about $34,600. So just some examples, right, of how one could use that benefit amount. All right, and just the last slide here before we get to the Q&A section, but some great news that we want to share about the last legislative session of 2024. So the legislature passed a new law allowing people to take their WA Cares benefit with them if they move out of state. So under this new law, starting in July of 2026, Washington workers can choose to continue participating in the WA Cares Fund if they move out of state. And to become an out-of-state participant, workers must have contributed to WA Cares for at least 3 years, again, on which they worked at least 500 hours per year, and also must opt in within a year of leaving Washington state. And just like other workers, out-of-state participants will keep contributing to the fund during their working years, and the state will create a process for these out-of-state participants to report their earnings and pay premiums, of course, with the focus of making it as easy for participants. And benefits for out-of-state participants will become available starting in July of 2030. All right, so that concludes the WA Cares portion of the presentation, and we'll jump into our Q&A.
Thanks, Sebastian. I'm going to go ahead and start going through some of the questions from the Q&A portion. and also read some of them that are coming in from our Facebook. I'm going to go ahead and start with questions for our panelists. Is vulnerable adult registration with police required across the state? Not sure which panelist might be best suited to answer that.
I can take a stab at it. I think that's just a voluntary program. Certain uh, jurisdictions might entail. I do not know of it being a requirement across anywhere, especially with like long-term care facilities. We do encourage long-term care facilities to interface with their first responders so that they know how to just kind of as general information of like where they would need to evacuate to, how many people are in there, just as part of their pre-incident planning. But for the most part, that's not a requirement that I'm aware of.
What are warning signals, or what do warning signals sound like, and are they universal or do they vary by community location?
So I can jump here on this one. I would probably want a clarification of what warning signals they mean, but I can talk about some of the different siren systems that we have in the state that people in certain jurisdictions would hear. The one that I'm the most familiar with, obviously, is our tsunami network of sirens. We have about 121 of them along our coast, and those are intended as a warning system for distant tsunamis, like a tsunami that is coming where you didn't feel the earthquake. So maybe the earthquake took place in Alaska or Hawaii or Japan, and then the tsunami is traveling toward us. The sirens are activated on our website. You can hear it. I'll try to put that link in the Q&A after this. We test it daily, silently, and then once a month you'll hear it talk like a giant voice saying, you hear the Westminster chimes and then say, this is a test of the siren system. And then we test it once a year on Shakeout, which I mentioned, with the full wailing sound. So if you ever wanted to go out on the coast and hear it, you would hear it on that day, it's a big wailing sound. Now, there are other siren systems that exist in Washington State, one in the Hanford, Columbia Generating Station area. They have sirens. They also test theirs on Shakeout usually. And then we have Lahar sirens for the Mount Rainier Lahar zone. And that's if, Rainier ever let that big deluge of mud and, comes down. You would hear sirens there as well. They do not test theirs on Shakeout, and that system is run through Pierce County. But I will put in a link of what it sounds like if I can find it fast enough, because it's quite loud. It's meant to be loud and heard outside for anybody that would be on the beach or in a Lahar zone when something like that occurs. Otherwise, you would get a message to your phone. It sounds like what, if you have an Amber Alert or a Silver Alert, that sort of message that comes through on your phone, you can get those.
Thank you. What is the state's ability to broadcast on radio frequencies independently of having to work through the media or radio stations?
These are such good questions. So we don't have access to them per se, but we do have like a memorandum of understanding for just alert and warning notifications that you would need to, like what you would see on your television screen that comes across as a ticker tape, or what comes through the radio broadcast when there is an emergency. But we're not in control of that. We just have agreements with the radio stations to broadcast that.
But one really good resource to have in your emergency kit is a NOAA radio. That would be a great way to receive messages if we're not receiving them through our news media platforms. So that might be another good thing to have in your kit.
It's such a good thing. And that comes through the National Oceanic Atmospheric Administration, so NOAA. And they broadcast obviously weather and geologic hazards, but they can do other things as well.
Are there things that you can do to plan for an emergency when you have to take medications or have medical equipment that you need to take with you if you can't get, I I think they're asking like if they don't have enough supplies, like if their prescription.
So this one's a tougher one, and I'm gonna let Serena weigh in too because she does the health aspect of it. There are laws that allow for people when there are emergencies to fill an emergency prescription, but there isn't anything currently in place that allows you to pre-position medication. So often we will tell people to try to refill at their earliest and see if they can save some that they can save up. The best thing you can do is just write down a list of medications that you take. So in case emergency personnel is at your home, or if you're at a shelter, you can say, here is what I take, and then they can get access to it. It doesn't work for everything. Like if you have an inhaler or if you need injections for dialysis or you rely on a breathing machine. So that's something that like Department of Health or DSHS might know more about, but it's something that I struggle with in our messaging is to try to do your best to stock up if it's like a pill. But some of those other things, you just want to make sure that you have it written down, the exact prescription, and then it's, save it in something that's fireproof or waterproof or on the cloud system or in a USB device.
And there are lots of people working on these issues as well, right? It takes the whole community. It takes all of us working together to make sure that everyone has the resources they need during an emergency or disaster. So there is an effort led by the Washington Pharmacy Association to make sure that pharmacies in our state have access to the pharmaceuticals during disasters and ways to get those to the populations that are impacted. So that is underway. It is a wonderful work group. They have made a lot of progress and a lot of people working on that.
And as
And
far as
oh, go ahead.
medical equipment too, there's some really like practical things you can do. One of them would be to notify your utility company ahead of time so that they know that you're on a like life-sustaining equipment. They prioritize you for like power restoration and that sort of thing. And there's even some programs in place that they can provide some backup batteries.
Great. I think we'll do one more question and then we'll do one walkers question. If you do have questions about walkers, our customer care team will reach out to you directly after this. I'm just trying to get through some of the questions with our panelists first. I do have, and maybe for Serena, more information about deaf, blind, and hard of hearing people, how they can get alerts and what it's set up and how it works, or if you have links to any of that information.
Right now, we're at the very beginning stages of this in developing our work groups, our processes, how to make sure that when emergency alerts are issued, that they are translated in a timely fashion and put to the population. So right now they're using things like YouTube to post their translations. They are using their Gov Delivery mail system that they already have in place and expanding that access through our work group. So it's in the works still. If you have great ideas, we're happy to hear them and get involved. Thank you.
We also have bed shakers that can be attached to your NOAA weather radio for people who don't hear the NOAA weather radio. So it will shake the bed, or alert you that there's a warning coming in. And we have on a few of our sirens on the coast also installed some strobe lights. So for people who can't hear it, they can see that something is going on. That's kind of a pilot right now. I think there's only a couple of sirens that have it, but we're working on that. I don't really have a way to post the siren sound in the chat.
If you send it to me, I can post it for you.
Awesome.
And then we can do one question quickly, Sebastian. So there's a question about how the rates are calculated in the examples on the slide.
Mhm. Yeah, so let's see. Okay, I'm looking at the question now. So I'll speak to the sort of how the caregiver and CD1 and how they can be hired. So once someone is eligible for their benefit amount, of course, like we mentioned, they can pay a family member, a friend, right, a loved one, spouse for to provide care for them, and that could be through the Consumer Direct Care Network of Washington, so CDWA. They could also be employed through a home care agency that could employ that family member or person that the beneficiary selected and as a certified home care aide. So there's also DSHS is also developing a third option to pay family and caregivers to provide more flexibility to WACARE's beneficiaries. And of course, in addition to that, all paid family and caregivers will need to participate in some sort of training to make sure that the health and safety of them as well as the person that they are caring for, of course, is considered. So
Great, thank you. Think that's all the time that we have for today. As I said, if you have a question that was unanswered in the Q&A portion of the website, we will reach out to you directly with an answer. Thank you all for joining us. Our webinar next month is on seniors and the housing crisis, and that's on May 1st. And you can register on our website at wacaresfund.wa.gov/webinars. There you can also find a recording of this webinar along with today's slides. Thank you all and have a great afternoon.